there's a lot of reasons why I picked bariatric surgery to specialize in. Of all the specialties, I think that patients tend to be very educated and very motivated in bariatric surgery. This is a disease that they want to get rid of, they want to get control of, and they're very eager to do that. In addition, I grew up with a father who suffered from the disease, so it's near and dear to my heart in that aspect. I think you get to a point in life when you have a problem with something that at some point you get at a fork in the road where you want to do something about it. You want to either make it better or you're going to get worse. And I think these patients have gotten to a point where they truly want to make a dramatic change in their lifestyle and be healthier and be there for their family and friends and more importantly for themselves. And I think they're just at that point emotionally where they want to get better control and be healthier. The large majority of diseases that are related to morbid obesity, whether it be diabetes, high blood pressure, high cholesterol, sleep apnea, dramatically improve or go into remission when patients lose a significant amount of weight. And we see that over and over. And the studies bear that out. Ideally, we would operate on patients who meet the criteria in that they're morbidly obese, but have not yet had years of diabetes, high blood pressure, sleep apnea, have not had years of these complications from the obesity. Therefore, you would operate on the healthiest patients that are morbidly obese to prevent them from getting to that point. Unfortunately, that's not realistic. Most of the patients that come to us already have some problems. But the ideal patient, of course, would not have all of those problems. We offer the laparoscopic adjustable gastric banding. We offer the laparoscopic vertical gastric sleeve resection. We offer the laparoscopic Roux-en-Y gastric bypass, as well as the duodenal switch. In addition, we do all types of revisional surgeries. So people who may have had a gastric bypass in the past that need that revised, and they've regained their weight and they need that revised. People who have had an adjustable gastric band and have had a complication and need that revised. So we offer that range of revisional surgery as well. I've done around 2,000 operations, so about 500 have been adjustable gastric bands, and then around 1,500 stapling procedures, which are the bypass, the sleeve, and the duodenal switch, and then several hundred revisional operations. Gastric bypass has been done, since the late 60s, and there have been many changes, throughout the past 30 or so years. Laparoscopic gastric bypass took off in 1993 and is clearly the gold standard operation in the United States that other procedures need to be measured against. How well do they do compared to the gastric bypass? The adjustable gastric band has been around for just over 15 years. It really started out in Europe and has been in the United States since 2001. It got FDA approval in the United States. And the vertical gastric sleeve has been around for quite some time as part of the duodenal switch operation. And as a standalone operation, we have good data, going on, 7+ years. To think that everybody is the same and everybody eating habits are the same and their complications of morbid obesity are the same is really not accurate. And so some folks, because of their lifestyle, may be a better candidate for a gastric bypass. Some people, because of their eating habits or because of how they want to use this tool, they may want an adjustable gastric band. And so I think that if all I did was an adjustable gastric band, then all I'm going to offer you is an adjustable gastric band. And if you want something else, you're going to have to go somewhere else. So I think that being able to provide all of the procedures allows us to look at each individual person, everything they bring to the table, and try and help them decide which option is going to be best for them in creating this lifestyle change that they desire. We always try and do the surgeries through a minimally invasive approach, meaning through 4 to 6 small incisions. You may have to, convert to an open, traditional, bigger incision, but about 98% of the time we can do the surgeries laparoscopically. When you start talking about revisional surgery, people who have already had their weight loss surgery in the past and now we're trying to revise that, probably about 75% of those we can do laparoscopically, and the rest, just because of the scarring and things, have to be done in an traditional open fashion. With any surgery, there's risks, and so what we do is we know for each patient, for their particular diseases that they have already and their particular comorbid conditions, and what procedure, there's pretty typical complications that happen with each procedure. And so what we do is we have in place a system where the staff are trained to pick up on those subtle issues, as well the patients themselves. They know things to look for once they leave the hospital, and even while they're in the hospital. And so we're on the lookout for those complications and for those signs and symptoms. And the key to treating complications is to recognize them early and treat them effectively. And so that's what we try our best to do. I've decided to dedicate my full practice to bariatric surgery because I think the patients benefit from my complete focus being on them. Clearly, there's all the physical benefits. If someone has diabetes or high blood pressure, sleep apnea, that's going to improve or go into remission. But psychologically, all of these folks, they just seem more confident. Their self-esteem is up. Their really motivation to live and be active and do things that they haven't done in a long time or have never done just seems to skyrocket. The surgery is really the easy part of taking care of these patients. The hard part is dealing with the weight coming off, dealing with their own reaction to themselves, dealing with family and friends' reactions to them. Sometimes it's good. Most of the time it's a very good reaction. But sometimes, there can be, it can be a very stressful reaction, a very stressful time. So losing the weight and then dealing with that weight loss afterwards can be a struggle. The folks we have here fit one of two categories. They're either patients themselves, or they're folks who are just very committed to this specialty and this group of patients, and they enjoy working with this group of patients. And I think that shows in their relationship with the patients and how they treat the patients. When you operate on patients from a wide area, there's only so much support you can give to each individual person. Here, we clearly provide them with office visits. We have a support group meeting every month. We have a monthly newsletter, and basically we're available to them, anytime they need. A lot of these patients have diagnosed or undiagnosed depression. Patients have issues with self-esteem. Patients have issues with confidence. But more importantly, these patients deal with a problem that they can be successful in every aspect of their life, but they have been a failure at controlling their weight. And the problem is that most of the time they've been a failure over and over again. So, if you have other problems, you can sometimes hide those problems and no one ever knows that you're dealing with them. But having this problem, you can't hide it. It's there for everyone to see. And I think that a lot of problems result from people's reactions and how people treat you and expectations. So I think that all of that fits hand in hand. I think there was a stigma with morbid obesity in the past as well as in the future. I think it was looked at as this is a personal problem of one's own self-control and their own will to do what's right for themselves. And I think that with the recognition of morbid obesity as a disease, it's yes, patients have a responsibility, but there are a lot of factors, that go into someone being morbidly obese, from physical to emotional to psychological and to social. And I think you can say that about a lot of diseases. So I think that in the past, when it was looked at as more of something that the patients had done to themselves instead of its own disease, there was a stigma attached to it. And there were very few surgeons in the country doing it. So you had to travel. And now, since it's become more accepted and more studied, and we know clear-cut benefits with each procedure and with different groups of patients, it's become very accepted as treatment for these patients in this devastating disease. We have a basic criteria that everybody, you want everybody to meet, right? In terms of, they need to be psychologically stable and not have any uncontrolled psychological illnesses. But in terms of the patients that I look at and know that this patient is going to do well, it's the patient who comes in and is already ahead of the game. They already have their notes from their primary doctor. They come in with their packet ready. They're the ones that show up to their dietary class. They show up, they schedule things. They're very motivated and a very active participant in that. When I see someone who comes in with their packet and they have all their documentation and, they tell me this is what I'm going to do after surgery, those are people who are very self-motivated. They're not going to need pushing. They're already pushing themselves. Now, that doesn't mean that people who don't do that can't be successful, but I think those folks may have a little bit more of a difficult time with being self-motivated. Erin's a great lady who was an ideal patient. She was young. She was relatively healthy, but she did have the disease of morbid obesity. And it was affecting her lifestyle, and she saw complications that were coming her way. She had a laparoscopic gastric bypass performed and has just done fantastic in every aspect that you can imagine. So if you want to look for an ideal patient, there's an ideal patient. Jeff is a go-getter. If you look at just his life, things he's done, he again is one of those ideal patients. He did have some health issues, clearly. He was not just morbidly obese, but he had some clear-cut significant complications from it. But he is a person who had a laparoscopic adjustable gastric band and used it as a tool the way it should be used. He used that to make serious changes in his eating habits, which allowed him to lose weight, allowed him to become more active, and then he's just taken the physical activity and the exercise to a whole new level. And the only reason he's a success is because of what he's done. He adheres to the lifestyle changes, and he eats healthier, and he exercises regularly. And he uses his band as the tool to allow him to do that. Tasha is another ideal patient. She's young. She has a few health issues, but she really doesn't have significant complications of her morbid obesity at the point that she came for surgery, but saw them coming and decided to make that change. And we did a laparoscopic vertical gastric sleeve, and she's done fantastic. I think she's a year out and has lost around 70% or more of her excess body weight. And you can just tell in how she acts, and I mean, she was a bit of a firecracker before, but she's just, she's a great girl. Clearly, they look dramatically different, externally, physically, but I think you can definitely see changes, and the changes that I'm able to see, for the time that I'm around them, is you see and you hear it in the way they talk and the things that they do. They are just, like I said, they're more confident, they have more self-esteem, they have a desire to do more, and it can be anything. It can be, some people have a desire to go to the amusement parks and actually ride the ride with their kids because now they can with relative ease. whereas before it was, possibly an embarrassing situation. That just spills into all aspects of their life. People see them, and sometimes imagining losing 100 or 200 pounds seems impossible. But now when you're sitting here talking to someone who says, no, here's a picture, this was me, and this is me now, and this is how I did it, and you can too, I think that's pretty motivational. As well, to see folks who may be dealing with a problem a year or 2 or 3 years down the road after surgery, whatever that problem may be, physical, psychologically, to be able to see someone who says, yeah, I've done that, and here's what I did. I think that's very motivational and inspirational to someone who's going through that same issue or same problem. I'm the one that's fortunate to be able to do the surgery on them, and more fortunate to see them take that and run with it. They have the hard part. I have the easy part. They are the ones who are changing their lives. They're the ones that are taking that tool and using it to its maximum potential. So I can't take credit for the work that they do. What's really pleasurable is when you see someone that are 2 or 3 or 5 or 10 years out, and they've made all of these changes, and to know that you were a part of that. You're not responsible for it, but you at least helped provide a tool for them to do that with, is a real honor and privilege.